a pleasure to have all of you here with us today. This is the 25th year of hosting this annual Men's Health Summit, which has served as a vital forum to address persistent health disparities impacting men and boys in our community, but mostly in most communities as well. During today's program, we will explore strategies to advance men's health, shed light on the social determinants of health, the barriers that prevent men from being healthy, and that contribute to premature mortality and morbidity rates, and also provide health education. We have a couple of workshops that we are hosting. We're trying to get the young men engaged in care. So we have the future generation when we're gone. We're not gone yet. They're on the way. So as we continue our efforts to improve men's health and quality of life, we will also celebrate 5 outstanding men's health champions who reflect the communities we serve and exemplify through their professional and personal experiences Whittier's mission to address health equity, social justice, and the economic inequities that impact the diverse communities we serve. The theme for this year's summit is transforming the health and well-being of men and boys from silent struggles to stronger futures. Too often, the physical, mental, and emotional health challenges that face men are shrouded in a culture of silence. I have 3 sons and 3 nephews. Dr. King will tell you, please tell 2 of them. It's shrouded in a culture of silence. Social norms around masculinity routinely discourage men and boys from expressing their emotions, showing vulnerability, and reaching out to friends and family when they are struggling. Under this, what we think is repressive and outdated definition of manhood, the social and cultural pressures to be a man reinforces the science surrounding mental health, substance use disorders, and preventative chronic diseases. The cycle of silence, stigma, and suffering places a disproportionate and unique burden on men and boys of color and low-income people who face systemic inequities that restrict access to high-quality and culturally informed health and support services. If we are to transform the health and well-being of our men and boys, we must start by dismantling the shame and structural barriers that keep too many from accessing support they need and deserve. Breaking the cycle of silence and struggle means transforming not only our systems, but ourselves individually. As healthcare providers, leaders, practitioners, we must unapologetically embrace social norms, social, economic, and racial justice. In our work, we're not only just focused on your health, we try to address those social issues and economic issues. Your health is your wealth, but without wealth, you cannot have good health. So we try to address those social issues in the programs that we design. As individuals, we must engage within our families, our workplaces, and wider communities to build safe spaces where men and boys can share their experiences openly and be seen, heard, and supported without judgment. Before we start to delve into the program, hear from our champions, hear from our panelists and workshops, we want to extend our heartfelt appreciation to our sponsors, whose generosity has made this year's summit possible. Their support allows us to fulfill our mission to serve as a center of excellence that provides high-quality care to address health equity, social justice, and the economic inequities that we serve. We also want to thank raffle donors. In this program, we have some exciting raffles, gifts from the Celtics, from the Patriots and the Boston Bruins, ice cream for those of you who like ice cream, and so on and so forth, and gift cards. So it's really an exciting time. I mentioned the social determinants of health and how we need to address them to really bridge the gaps that we see. And these are issues around economic stability, income, and employment and food security, education, healthcare access, neighborhood environment such as housing. For a lot of our patients, they spend more than half of their income on housing because Boston is a very expensive place to live. And the social context of how race and racism impact all of our lives. And when we started this work at Whittier, we're a healthcare facility, but we understand that health behaviors contribute a significant portion to what makes us healthy. In fact, 80% of what keeps us healthy is our lifestyle, our behaviors, what we eat, what we do. I'm not trying to talk Dr. White and the rest of us are out of a job, but only 10% is access to health care. Because you spend a day in the doctor's office, but you spend 364 days out there. So it's what you eat, how you exercise, what you do. So when we saw this study, we've been looking at this since 2007, it helped to transform our programs, where if we're focusing on diabetes, we have to focus on all these barriers that impact people's health. And as you continue to see the leading causes of death in men, cancer, heart diseases, accidents, but for all of that, Black men have the highest rates of mortality and morbidity. And this is why we continue to focus until we close these gaps. And then we see the opioid-related death. For men, the 72% of death related to opioids is for men. And it's declined somewhat for white men, but it's remained elevated for Black and Latino men. And at Whittier, 40% of our patients are Black, 50% are Latinos and Hispanic. So that's why we have to delve deep into these numbers. And again, we have a program called It Takes a Village. When people look at substance abuse, they think it's a social issue that you can just shake off and move on. And when it was in the minority community, it was a legal issue where people were incarcerated. When it hit the suburbs, it became a disease. It is a disease, and that's how we address these inequities. So another area that is an issue for men is the access to health care. Low income and Latino men are less likely to have health insurance. While health insurance does not guarantee that you will have good health, if you don't have it, you don't have the access to health care. And the Affordable Health Care has changed that somewhat. But as we hear about plan changes around Medicaid, Medicare, that's going to set us back. And that's what we continue to fight for. So, we tell our men that it is important to have those routine care, early detection. Even as a mother, even though my kids are grown adults, I found a way of scheduling the appointments because if I don't, and one of them, Dr. Kim knows, hates needles. When he gets a lab result, he disappears and I need to call and make sure, FaceTime me, let me see you sitting in front of that, but that's David. Because he looks for every single way, and so those are the early detection, management of health issues, facilitating maintenance of health. Those are the choices that we make. I mentioned that 80% of what makes us healthy are those healthy lifestyle choices that we choose. A nutritious diet. We all should have a cheat day, but do the best, to remain healthy. We have a program called Prescription for Health, where our patients are prescribed a prescription for health by their physician, their psychiatrist, by whoever they interact with. We have a state-of-the-art fitness center that they can go exercise. We have a nutritionist. We have a teaching kitchen. We have a community garden. Because you would say, well, why does a healthcare organization need all those things? It's because those are the social determinants. We have a food pantry. We have the WEEK program. If you don't have access to healthy foods, then all of these issues that we're talking about cannot be addressed. And we also screen for tobacco and alcohol consumption at every level. We start to screen for tobacco from age 12, and believe it or not, the kids are dabbling. And mental health support is another thing that we really focus on. Mental wellness, something that is a stigma in almost every culture. And also the reason why it is a stigma is also how insurance is based. The reimbursement are not at the same rate as you would have if you were a primary care. And people are ashamed. I mean, we use words like, he is crazy, but we don't say you're diabetic. I mean, we don't put that same stigma to diabetes. And for all of us, we all have periods of depression, anxiety, and PTSD. But men are 4 times more likely and 3 times as likely to die from drug overdose than women, and they are less likely to seek help for mental health issues. So what we're saying to our men and our boys, you're not alone. Address it. Address your mental health and your substance use disorder as you would any issue that you're having. And if you're looking for a primary care home, we have a wide range of health and social services to really tackle and address these issues. Men and boys often fear judgment when speaking up about their mental health challenges, and as a community, we have a responsibility to meet their honesty with unconditional support, not stigma or shame. So please engage the men in your community, please engage the boys in your community in non-judgmental conversations about mental wellness and encourage them to seek help. If you suspect that there's something that's just a little off, we all have off days. I know I have more off days than good days, so, but seek that help. And another thing that we're doing lastly is typically around research, it's done in the academic hospitals, and it does not reflect the community we serve. Minority people, if we're looking for clinical interventions, they are not reflected in the studies, then the drugs that are created will not reflect what works for us. So on the 5th floor, we have launched a Center for Health Equity Research, and for men, we're focused on colorectal cancer, diabetes, hypertension, kidney disease. But as we look at the population, we also focus on those disparities, racism, our race, our ethnicity, our language, our immigration status, our country of natural origin, our socioeconomic status, all those things that are barriers to our health. So we have a lot of work to do. I'm excited to hear the panel discussion, but this is just a brief introduction of what we see as the challenges. It's a lot. But one thing about us at Whittier, no challenge is too big. We're tackling them every single day, and we're beginning to see the improvements. When we started focusing on life expectancy in 2007, the average life expectancy of a person living in Roxbury was 59.5 years. After 10 years, not that we did the work, the patients did the work, the community partners through cross-sector partnership, it increased by 10 years to 69 years. So we can, if we're committed, make those changes. And all of you, in all aspects of your work in life, have an impact in making that change. So thank you. Every year, we are proud to host the summit calendar of community events. If there's any health issue, any health topic, we want to touch it because education is so critical in engaging our patients, partners, and broader community in important conversations, sometimes difficult conversations about health equity and social justice. These events not only raise awareness, but educate and empower our patients to manage their health effectively. Thank you for your continued support of Whittier Street Center and all that we do. I am now proud to introduce this year's cohort of Men's Health Champions. Today's award recipients are a distinguished and accomplished group of men who embody the values of resiliency, community, and hope. The accomplishments and integrity make them phenomenal role models. I'm chopping you up, so I can. You know, when you go to church on Sunday after church, they say, go out and serve the world. So this is it. After that, we'll go serve the world. These accomplishments and integrity make them phenomenal role models within our community and for the next generation. We are proud to honor our 2025 Men's Health Champion for their outstanding contributions in advancing men's health and promoting equity. First, honoree Damian K. Whittier. He's a key account manager for federally qualified health centers at Quest Diagnostic. Doug Dixon, managing director of Santander Bank. As I said, when we look at health equity, but we also look at economic inequity. So we need a banker. So we're talking about what we need to do. Jim Keane, Dr. Keane, is the executive director of the Boston Bulldogs running club. Lino Sanchez is the founder of Urban Achievers High School, an exciting new school that he'll tell you all about. And our dear friend, Stephen Rotman, who is a human capital operating partner and U.S. HR leader for B Flexio. Please give them a round of applause. Is Damian K. Whittier, a respected advocate in healthcare and health equity who's rooted in our community. Born and raised in Roxbury and Dorchester, Damian has dedicated his career to advancing patient-centered initiatives in healthcare access and delivery. In August 2025, Damian will celebrate 16 years at Quest Diagnostics, where he currently serves as key account manager for FQHCs across Massachusetts, helping to expand access to critical diagnostic services in underserved communities. His dedication to health equity began early in his career when he worked at the Boston Medical Center and Boston Medical Center Health Plan, where he supported mass health Medicaid enrollment for vulnerable populations, ensuring thousands of families receive the coverage and care they needed. Beyond his role at Quest, Damian works to grow diversity, equity, and inclusion within his field through professional mentorship and service opportunities. He currently serves as New England Region's co-lead for the Quest Diagnostic Sales Council and national co-lead of the African American Business Leaders Employee Business Network, where he uplifts employee of color and strengthens partnership with nonprofits like ours across the country. Damian is not only recognized for his strategic leadership, but for his tireless advocacy to ensure that underrepresented voices are heard and centered in healthcare spaces. He demonstrates a lived experience growing up in Roxbury and Dorchester. He's walked in the shoes of the patients that we serve and demonstrates our commitment and our mission to health equity and social justice. Damian, for these contributions, we are proud to recognize you as a 2025 Men's Health Champion. citation from the mayor or a citation from the governor. So, should I go this way?
Thanks, everyone. Wow, Frederica kind of said everything. I don't know what to say, but I don't usually do this, so I'll keep it brief. I just want to first say that I am a child of the Community Health Center. From birth to pre-adolescence, my mother who is here would bring me to the Community Health Center right down the road, where I received all my health care. So to be able to serve health centers in this capacity is it's a blessing. It's a dream come true. I believe that, I truly believe that if you are faithful, obedient, and patient, God will put you where you should be. And this award today is a validation of that. It's much more than just a recognition. It's validation of my purpose. So I thank you very much for it. The funny thing is that like 10 years ago, me and my director was here, Matt, we worked in different roles at Quest, and we met here at Radio 3000. Problem resolution role at that time, and learned a ton being here, working with Dr. Subi and beyond, who was here in the lab. But it was great for me. Fast forward to early 2024, I'm working with Whittier and a number of other health centers, bringing education on our testing, our health solutions to the health centers. And I just want to thank you, Frederica, Dr. Wright, Whittier, for being so embracing and welcoming to me. We've done a lot of different educational grand rounds for your providers, and I look forward to what we do in the future. Thank you to my wife, my daughter, my brother, my son. Thank you so much. You guys are why I do it. I love you very much. Thank you so much.
Thank you, Damien. That's wonderful. Our next honoree is Doug Dixon, a distinguished financial leader and longtime advocate for health and economic equity. With more than 25 years of experience in the banking industry, Doug has leveraged his expertise to support healthcare, education, nonprofit, and governmental agencies throughout Greater Boston. Doug currently serves as the managing director at Santander Bank, who we do business with, where he brings experience spanning the full spectrum of banking, including managerial, operational, customer-facing, and regulatory roles. His extensive knowledge of commercial banking, entrepreneurship, client cultivation, and team leadership has made him a trusted ally to numerous healthcare and nonprofit organizations, including the Whittier Street Health Center. Being a long-time supporter of Whittier Street Health Center, he recently joined our President's Advisory Council, working with another banker who is on the advisory council, Mr. Bob Mahoney. Yes. His commitment to empowering underserved communities through sound financial planning and institutional partnership has been instrumental in advancing Whittier's mission. Doug has consistently leveraged his role in the financial sector to advance health equity, forming meaningful relationships with health centers and community-based organizations dedicated to serving vulnerable populations. His career demonstrates how cross-sector partnerships, when rooted in shared values, can help to dismantle systemic barriers and expand equitable access to care. For your unwavering dedication to community investment and empowerment, Whittier Street Health Center is pleased to present you with the 2025 Men's Health Champion Award.
Good morning, everyone. Thank you so much for being here at the center. It's really been fun to be part of this. About 5 years ago, mutual friend, one Bob Mahoney, put me in touch with Frederica to come out and talk about some banking. And as I was getting ready for the meeting, I had going through notes and thinking about the center, Bob turns to me and he says, when you go out there, make sure you bring your A game. Sure. And sure enough, in the boardroom right here in this very building, Frederica, always on point, let me know what she was thinking in terms of banking and what it needed to be. But the outcome of that meeting was she entrusted us with some of the funds of the center, and that's something we take very seriously. So we're proud to be part of the system here and taking care of some of the finances for the center. And it's gone on from there. It wasn't long before her spell was cast over me, and we started doing some fundraising. We're supporting events. The women's tea event is something that we sponsored for many, many years now, along with the roast event, which is a big fundraising piece for the center. And it's just been fun to be part of all of that. My employer, Santander, through the communities program that we have, has been a big proponent. That's where a lot of the funding that I'm able to provide at the center comes from. It's a $13 billion commitment we've made over the last 3 years, and that follows another $13 billion commitment that covers the prior 5 years. 8 years, $26 billion or so. What I would add, I'm the banker. Why would a banker be here in healthcare? But I think one of the more overlooked pieces of wellness in generally is financial wellness, and it was on the slide. There are pieces of your financial situation that you can't control. Not a lot we can do about that, but for the ones we can, I think a local banker, can be very helpful in those situations. We have a branch not far from here. Things like budgeting, mindful spending, help with the mortgage, maybe just general financial literacy. Those are things that the local bank can help with and can help with those parts of just overall wellness. So give that some thought. And again, thank you for the time here today.
In December, the Women for Whittier team. At the Men's Health Summit, we have both genders, men and women. At the Women for Whittier team, we have 149 women and dogs. So he's an ally, not only for economic equity, but also for gender empowerment. Thank you. Our next honoree is someone who I've known for many years, and I am now proud to recognize Dr. Jim King, a nonprofit leader, educator, and advocate whose life's work reflects a deep commitment to community, equity, and human service. With decades of experience in education and mission-driven organization, Jim has used his voice and vision to uplift communities who are often left behind. As a former high school principal, educator, and track coach, Jim's commitment to service stems from a career of community building across educational and nonprofit spaces. His work is grounded in the belief that building strong, connected communities is essential to individual and collective well-being. He holds multiple advanced degrees, including a PhD in social ethics and theology from Mosaique University, and has founded and led numerous service initiatives guided by his commitment to faith and social justice, including the Hope Community Supper, the Yale Committee on Social Ministry, the Brother Edmund Rice Solidarity Initiative, and the Francis Xavier International Scholars Program. He currently serves as the executive director of the Boston Bulldogs Running Club, a local running club that promotes wellness and community engagement for individuals in recovery from addiction. As a person in recovery and self-described workout and wellness enthusiast, Dr. King draws on his story to inspire others to reclaim their health through the transformative power of movement and mutual aid. His life and career show how, in speaking up about our struggles, we can transform our personal challenges into possibilities for collective wellness and empowerment. For your enduring commitment and for being patient with my two sons that you taught, our commitment to promoting health and holistic healing, Whittier Street Health Center proudly recognized Dr. Jane King as one of our 2025
Thank you so much. Thank you for wonderful words. I'd like to express my gratitude to the Whittier Health Center, of course, to Whittier, in particular for the honor of being recognized as a 2025 Men's Health Champion. I also want to extend my congratulations to my fellow honorees. I am here today because I represent an extraordinary organization called Boston Bulldogs Running Club. Many of our members, myself included, have found that running, wellness, and community can be powerful tools in recovery. Not only do they offer profound physical benefits, but running, wellness, and community also help alleviate anxiety and depression. Additionally, participation in the community helps our members break out of themselves. Many of them self-isolate. It helps them break out of themselves so that they can grow and heal. In addition to organizing 6 runs a week at 5 different locations, we do several other programs as well, including drug prevention initiatives for youth and community service activities at shelters, recovery centers, sober living houses, jails, and hospitals. And we do that because in recovery, you can't keep it unless you give it away. So we share hope, running, wellness, and community with those still struggling with addiction and other issues. It gives meaning to suffering. It gives meaning to the suffering that we have experienced in the past. While many of our members are involved in AA or Narcotics Anonymous or other health groups, or we use other strategies for wellness, we encourage them to also incorporate running, wellness, and community. And that goes to everyone in this room also, okay? It's not just for people in recovery. Everybody benefits from this. We're a small but growing nonprofit. We have about 600 members. We think our reach is about 10,000 a year through different platforms. We are grateful for the opportunity provided by the Whittier Health Center to expand our programming into Roxbury. This is just I'm going to end with a commercial. We're going to do a pilot program. We're going to begin on Wednesday, July 16th at 10:30 a.m. We will gather at the sidewalk outside of this building in front of the exit near the side garden at 10:30 a.m. It's Wednesday, July 16th, 10:30 a.m. And we're going to meet each Wednesday at 10:30 until August 6th. We see how it goes. We start a weekly run in Roxbury. We want you all there. Beginners, walkers, advanced runners, all welcome. Thank you very much for this honor.
Thank you, Dr. King. Our next honoree, and maybe the two of you should have No.
Sure.
See, able to connect.
Wait, one step ahead.
Oh, yes. That doesn't happen to me. Anyway, our next honoree is Lino Sanchez, a lifelong Bostonian who has championed building spaces and opportunities for our city's young people to thrive. As a former collegiate athlete, Lino lends his experience to creating innovative programs at the interaction of sports and youth development. Lino is the founder and head of school at Urban Achievers, a Dorchester-based and soon to move close to us, Sports Education High School, dedicated to supporting children and families in underserved neighborhoods through athletic and academic programming. The first sports academy of its kind in Massachusetts, Urban Achiever is leading the way as a model of integrated health education and professional mentorship for students of color. With more than 20 years of nonprofit leadership experience and accreditation from Springfield College and Tufts University's Institute for Nonprofit Practice, Lino is deeply committed to removing barriers that limit youth's potential, including barriers to health and well-being. Following his own battle with cancer, he has been a staunch advocate for regular health screenings among men and boys of color, raising his voice to bring awareness to the importance of early detection and preventative care. Lino is a living testament to the values of leaders who reflect the communities they serve, bringing authenticity, empathy, and first-hand experience of adversity that guides his vision for a stronger future. Whittier Street Health Center is proud to recognize Lino as a 2025 Men's Health Champion for his steadfast efforts to empower the next generation of youth and promote men's health equity in our community. Congratulations.
So, I'm trying to be like our youth today and have everything with me. So funny, I could probably sit at a championship NBA game at the free throw line with no time on the clock and be as cool as ice, not flinch. But I sit here among you people, among people and family, loving and caring, and I am like crazy nervous. It's just wild. So I'm going to read from my script because I know we have limited time, but also because I know I tend to digress and can be all around the world before we get to the point. So first, I want to thank Frederica and the team here at Whittier Street. I can't thank her enough, especially as we're launching this school in September. Whittier Street and Frederica has embraced us with a partnership that is going to provide all of our youngsters all health and support services that they need. So thank you very much for embracing us. Thank you for bringing us in. So I'm deeply humbled to be recognized alongside so many powerful voices doing this incredible work. Thank you. I stand here not because I've mastered health, but because I've learned, often the hard way, I'm sure many of you can see, right, what it takes to stay alive. As a man of color, I was raised with the belief that vulnerability made you soft, made you less than. I wore that until the day I got sick. As you know, I was battling cancer, stage 3 level. But honestly, the heavier fight was internal against the silence. It was my culture, my upbringing, my pride, telling me to hold it all in. And as crazy as it sounds, it felt like the silence might kill me before it gets out. My wife and children changed that. I started to get a little emotional and I apologize.
What happened?
They gave me permission to break the silence, to heal, to live. This award belongs to them, for loving me through the fight, and for showing me that vulnerability is not just okay, it's life-giving. Thank you for this honor. I shared it with my family, who saved my life, and I dedicate it to every person who's still fighting in silence. It's time we retired that old script, because the silence is killing us far too often too long. Thank you guys very much. I look forward to answering questions. I look forward to being a part of this community, and I look forward to doing my part to ensure that all of our kids grow and lives. Thank you.
Our final honoree, definitely last but not least, is Stephen Rodman, a people-driven professional and passionate advocate for public citizenship. With more than 2 decades of experience in the life sciences and technology industries, Stephen has consistently used his platform to advance organizational culture and promote employee well-being both inside and outside the workplace. He currently serves as an operating partner at B-Flexion Life Sciences, where he helps to guide a portfolio of healthcare therapeutics companies while leading the firm's human resources strategy. In his previous role as Chief People Officer at Carol Farm Cares and Ipswich Inc., Stephen embraced the opportunity to create philanthropic opportunities for staff, enabling employees to give back to the communities, including volunteering and donating at Whittier Street Health Center, where they live and work through volunteerism, internship and mentorship programs, and fundraising initiatives. His passion for community service and health advocacy extends well beyond his professional endeavors. He proudly serves as another member of our Whittier Street Health Center President's Advisory Council. You speak to me once, you're on the president. And sits on the boards of Boston Pharmaceuticals, Allergy Partners, and the National Association of Business Resources. In all of these roles, Stephen has demonstrated a holistic understanding of health promotion, one that extends beyond the realm of clinical care to encompass investment in workplace wellness, community engagement, and the social and economic opportunities that shape people's lives. For his career and long dedication to advancing community well-being and corporate social responsibility, Whittier Street Health Center is honored to recognize Stephen as a 2025 Men's Health Champion.
Thank you so much, Frederica. As I sit here, it is the most amazing privilege to be here and be recognized, but almost embarrassing to be recognized by people like Frederica and Dr. Wright, for someone who is helping the greater community with health access and health equity. So people like Frederica and Dr. Wright, who day to day are here and fighting the good fight and bringing people in and doing whatever they possibly can. And so I really applaud you and your team and the staff here. The most amazing people, the most amazing community. Is just, it's overwhelming. It's overwhelming to be part of this initiative. A number of years ago, I was working at Cariform Therapeutics as the head of HR, and a mutual friend of Frederica and I didn't know Frederica at the time. Elisa Najimi said, I was working on some initiatives, and she said, you should talk, I know someone you should talk to. You should talk to Frederica. So I sent Frederica a note. I think she called me within 5 minutes. And so we're chatting, and Frederica's telling me all about Whittier Street Health Center, which I embarrassingly had not heard of, and too many people have not heard of, and that is my mission over the last 5+ years, that everyone should hear about this organization. But talking to Frederica, and she let me know some of the initiatives that she's working on here at Whittier Street Health Center. And so I went into the organization and I said, you know, we have open internship opportunities. Do you know anyone? Yes, of course we do. And every time I talked to Frederica, and then she said, let's join the President's Advisory Council, so I was hooked. And you know, for those of you who don't know Frederica that well, once she asks you to do something, you do it. You say yes, ma'am, and you ask later what it actually involves. You say yes first, and then you follow up, and then you're very thankful for that. And so what I applaud Frederica for is, she's always meeting the needs of the community, and Whittier Street is meeting the needs of the community. It isn't a straight line of, you know, we have these 5 services at Whittier Street, and that's it. During the pandemic, she said, people are afraid to come out and get vaccinated, so we bought vans, and we're going out to the community to vaccinate them. She said, people don't have access to dental care. It's so hard because of insurance and other factors, so we opened our dental clinic. She said, a couple of years ago, Frederica said, we're chatting, and she said, we're noticing a lot of problems with hunger in the community, even more than we have in the past, and people don't feel like they can go safely to the food banks that might be available to them. She said, so we have a food bank now. And so every time Frederica tells me one of the new initiatives, wherever I'm working, I've been very, very fortunate to go into the organization and say, we need a food drive. Whittier Street is starting a food pantry. We need to we'll be part of the annual roast. It's such an amazing opportunity for Whittier Street. And so I feel like what I have is a platform, and what I encourage everybody here and everybody you know, use your platform. I don't know exactly what it is to face the same health equity experiences as everybody else. I don't know that. What I do know is when you find a good thing, you stick to it, and Whittier Street is the best thing. And so whether it's raising money or raising awareness or volunteering or doing whatever it is, everyone has a way they can help in some way, and whatever way that is, I just encourage everybody here to scream it from the rooftops. Whittier Street is meeting the needs of the organization in a way that I find no one else in the community does. I'm fortunate to have exposure to a number of healthcare organizations and businesses in the greater Boston area and beyond, and nobody touches the realm of services and access and impact that Whittier Street does. So once again, I just encourage everyone, Whittier Street, scream it from the rooftops, please. We all have ways that we can help, and if we're not helping, we're hurting. And so thank you again, Frederica. This is absolutely the most amazing honor I can imagine. I'm so thankful my husband could be here, my daughter, my mother-in-law is visiting from Bolivia, and she, having the experience of something like this has been amazing. So I'm thrilled. Thank you, and thank you, everyone.
Thank you. Let us give a round of applause to all of our mentors. So we do a good picture. Yes, Miss Magnolia?
This is a board.
Mr. Rodman.
Your picture with him on the front.
Yes, we did. We took a picture. Okay. See Magnolia? That is my friend. I know. That is my friend and sister. She's a VP of Community Benefits at the Dana-Farber Cancer Institute. Let's give her a round of applause. What we will do, which will do a group picture with all of the reason you are award. That's what I thought you were going to do. Quickly before you move. Okay, now we are moving to our panel discussion. And I am honored to introduce a colleague of mine, Dr. Stephen Wright, who is a medical director, and he will serve as a keynote speaker for this event. He knows so many patients and touches. Every time I have a man that calls me, in fact, I don't even call the office, I call his cell phone and say, you have someone coming up, whatever you're doing, they're on their way, and he has done that. He goes above and beyond in his commitment to transform the health of our community, to stewarding impactful clinical services that break down barriers. Beyond his resume, I think what is wonderful, and you've heard from all of the champions, is Dr. Wright, all of us have the reason we excel and the reason we are committed. I've been CEO for 23 years. This is where we both have decided, this is where I'm gonna die. You know, this is my lifelong mission, is the lived experience, but also our patients inspire us, and we see that the little, I don't feel like we're doing a lot, but the little that we do, people are so grateful for it. And when people see Dr. Wright, they don't see a stuffy-nosed physician. They see a man, a person who is deeply committed to their care. I have to say to them, that is Dr. Wright. And he's like, no, that is Stephen. So they go against back and forth. And so patients, he's able to meet people where they are and connect to them. So well-educated surgeon, he's actually a surgeon that decided that his ministry is in primary care and has been with us first as, you think it's just the President's Advisory Council that people get linked in. He was just doing some part-time work here. He had all of these jobs and he was doing an MBA, and I'm like, Dr. White, when you get to our ages, we need to stop all the school and just start working the credentials and pick one place. And that place is Whittier Health Center, and he's been here. So we are so pleased, and it's a joy to work with him every single day. Dr. Wright.
Thank you so much, Ms. Williams. That is wonderful, and it is my great honor and privilege to be here. I've been here 12 years, and I started off just, I think, 1 or 2 Saturdays a month, and as was so aptly put, I got the spell. Not only because of the talents of Ms. Williams and the talents of our chair of our board of directors, Ms. Whittier, our amazing staff, but it's the patients. It's always about the patients. What can we do to improve our community? Early on, I became part of this men's health clinic. We have meetings once a week, and the manager asked me, Steve, could you come and give a little talk, a little discussion on some health topic? And it became routine, and I looked forward to it. and I still look forward to it. So on Fridays, 1 or 2 Fridays a month, I'm fortunate to be able to be part of a men's health clinic and get up and discuss health issues. And one thing that I've noticed is it's not just about men, okay? If we ask men to come in to get their physical exams, come in to get their checkups, come in to get this vaccination, usually it's the family behind them, their wives, their sisters, their daughters, that help to bring them in, drag them in. That's right. And because if it's left up to men to get their health care, we're not coming in unless it's falling off, right? We're busy working. We have to take care of the family. We don't have time for this blood test. So this men's health clinic that I'm fortunate to be a part of, we have men come in, men's health clinic, we go out into the community, and so I just wanted to thank all of you for allowing that to happen, and thank all of you for being here today. I'm so impressed by our panel of champions this year, men's health champions. I've already learned a lot and lessons that I will take into my practice here. But why are we here today? To celebrate men, because this is Men's Health Awareness Month, also Men's Mental Health Awareness Month, and we're looking at transforming the health and well-being of men and boys from silent struggles to stronger futures. So, let's break this down. This is a time dedicated to raising awareness about the unique mental health challenges and physical challenges men face, and we're encouraging them to prioritize their emotional well-being. This month aims to break down the stigma surrounding men's mental health and promote open conversations about these issues. That's really touching, Mr. Sanchez, what you were saying. How are men supposed to be? We're supposed to keep things in. Stoic, strong. Well, that can be detrimental to a lot of us. And as we go on, when we get to the panel discussion, we'll learn more about that. Let's break this down. According to the National Alliance of Mental Illness, there's often a strong focus on men's physical health, fitness, annual checkups, and heart health. But mental well-being is equally as important because mental health is health. Just as the body needs care and attention, so does emotional and mental well-being. Yet, there's a silent crisis in men's mental health, one that too often goes unnoticed or unspoken. Tragically, men are nearly 4 times more likely to die from suicide than women, underscoring the urgent need to break this silence and seek support. The Cambridge Dictionary defines transforming as a means to change completely the appearance or character of something or someone, especially so that that thing or person is improved. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Where the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. Now, wellness, that's the quality or state of being in good health, especially as an actively sought goal. We're talking about transforming health and well-being. So this means changing how we approach health, shifting from a focus of treating illness to proactively creating and maintaining well-being across all aspects of life. This involves reevaluating the existing systems, structures, and practices to prioritize prevention, promote healthy environments, ensure equitable access to resources that support overall well-being for individuals and communities. A more detailed breakdown, we can look at shifting from treatment to prevention, reevaluating systems and structures. Now, I'm that guy. I've got the answers to the exam before we take the exam. So I know that upcoming in our panel discussions, we're going to be talking about a lot of these things. So I'm just going to brush over these and we'll get more in depth during the panel discussions. But we need to prioritize equity and inclusion, fostering holistic well-being, empowering individuals and communities. In essence, transforming health and well-being involves a shift that moves beyond a narrow focus on disease and embraces a holistic, proactive, and equitable approach to promoting the overall well-being of individuals and communities. What are some of the silent struggles? We're going to get into this in depth with our panel. So men and boys often face silent struggles, which are challenges they keep to themselves due to societal expectations and stigma around mental health. These struggles can be displayed by emotional withdrawal, difficulty expressing feelings. How many of us guys have we heard from our partners, you're not expressive enough, say what's going on, but we tend to be closed off. There's also an increased risk of anxiety, depression, and substance abuse. So now, traditional masculinity, and it emphasizes strength and stoicism. So what's that? Being able to endure pain and hardship without the display of feelings and without complaint. This can exacerbate those issues by discouraging vulnerability and help seeking. I was fortunate enough to be in a fantastic residency that was really run and dominated by white men. It was traditionally a difficult residency. All residencies can be difficult. But in this particular residency, it was, you were looked poorly upon if you complained, okay? You gotta be strong. Back then, we had 36-hour on-call, 48 hours realistically. We've changed that, fortunately. And we held that with a badge of honor, okay? You know, my colleagues would often say, yeah, I've been up for 40 hours, and I've got a case to go in 10 minutes, and wow, that's a man. No, that's not quite right. That's not quite right. I want to say it's crazy, but it's not quite right. But see, back then, so that was 30, 35 years ago. And we had to be strong, appeared to be strong, or we were isolated. We could get pushed out of that residency. So, like everyone else, I kept my mouth shut, took the abuse. What did we say? Beatings will continue until morale changes. But we held that with a badge of honor, and I loved that residency, and I'm so glad that I did it. But now, 30, 40 years later, I can see that that wasn't quite the right thing to do. So they've changed a lot of that. But some of those struggles, some emotional suppression and isolation, talk about conflicting messages about emotions, the fear of burdening others, social isolation, lack of support. There are mental health challenges as well. We touched on that and we will delve into it more. Depression and anxiety, substance abuse, suicide, the toxic masculinity and its impact. We'll really get into this. The pressure to be tough, performance expectations, internal conflicts. How to address silent struggles. This is really the key. And again, we're going to talk about this with our panelists. I don't want to give the ending away, but it's really going to be great. Now, there are also things we need to look at. Silent struggles of men and boys of color. So we're adding another layer of complexity to all of this. So men and boys of color face a range of silent struggles due to systemic issues and societal expectations. These struggles significantly impact their mental health, well-being, and overall quality of life. Some of those key silent struggles are mental health disparities, stigma and reluctance to seek help, impacts of systemic racism and discrimination, limited access to culturally competent care. We're trying to eliminate all that here at Whittier Street. Toxic masculinity and emotional suppression. So briefly on the mental health disparities, there's higher prevalence of depression and anxiety compared to white counterparts. So this is for men and boys of color. Impacts of systemic racism and discrimination. There are experiences every day with perceived racism influencing the reluctance to seek medical help. Oh man, it starts when we were kids. Some of you guys, remember when you fell off your bicycle or whatever? Busted your knee open. What did mom and dad say? Come on, get up. Stop crying. Suck it up. Cowboy up. But you let your little sister fall. And I'm guilty of this even today. My little granddaughter, she'll fall. Oh, baby, come here. What's going on? So it starts when we're young. And we think that's the norm, that's the way things should be. And we carry that with us throughout the rest of our lives, thinking, well, I've got this going on, I've got this chest pain, I've got this, but you know what? Gotta go to work in the morning, I'm gonna button up my coat, I'm gonna get in and take care of it. Okay? So we need to change that. And our panel is going to help us take the lid off of that and see how we can do it. Now, let's dive a little bit deeper before we run into our panel's ideas. Silent struggles for men and boys of color in Greater Boston. So we know there are issues going on all over, but right here in Boston, how does it impact us right now? So in Boston, boys and men of color, particularly those from Black and Latino communities, face several significant and often unspoken challenges across various aspects of their lives. These struggles are often made worse by systemic issues and lead to significant disparities compared to their white counterparts. Education. So academic underperformance. So boys in general tend to lag behind girls academically in high school. And the gap is particularly pronounced in lower income districts, which often have high concentrations of students of color. There's a wider gap for Black and Latino males. Studies show that Black and Latino boys and young men in Boston have faced significant challenges in achieving proficiency in subjects like English, reading, and math. There's lower college enrollment and completion rates. There are fewer men, especially Black and Latino men, who are enrolling in and completing college compared to young women and white men. Only 34% of young Black men and 42% of young Latino men in Massachusetts have completed a bachelor's degree, compared to 53% of men overall. Why? Layers upon layers, and we can spend the whole afternoon talking just about that. There's still segregation and unequal resources in our school systems. employment and wages. So stagnating wages and declining employment, changes in the workforce such as the decline of manufacturing jobs and the rise of industries requiring higher education have contributed to lower employment rates and stagnant wages, particularly for men without college degrees. There's a significant racial wage gap. Black and Latino men without college degrees in Massachusetts earn significantly less, earn 35 to 45% less than their white male counterparts. Lower social mobility. Black boys born to low-income families in Greater Boston have lower rates of upward income mobility compared to their white peers. Health and mental health. We talked about there's a shorter life expectancy for men in Massachusetts and people of color in Greater Boston. Societal factors, systemic racism and discrimination. We're going to go through all of this with our panels, so I'm not going to give the answers to the test away right now. But I want us all to be aware that there are issues going on. We need to make some changes. Let's put it all together. Okay. What can be done to transform the health and well-being of men and boys from silent struggles to stronger futures? We talked about several issues. So, just giving you a brief look, open communication, start the conversation. Normalize the vulnerability. It's okay for us to have pain and to seek help. Challenge those toxic masculinity issues. That's a tough one. I see a young surgeon, I still want to say, come on, man, come on. It's tough to give that stuff up, but we have to. Build supportive networks. That's something we'll talk about as well. I'm going to end this portion of the program by saying, please make an appointment to see your healthcare provider. Start some of these conversations because there may be a reason why you have that back pain, and it may not be just due to lifting something, there may be something else there. If you don't have a healthcare provider, we're here. We're going to take care of you, your family, your friends. Come on in. We're going to figure it out. We will take care of you, get you on track. Ms. Williams has my number, so when you come by, she's going to call me.
I'm the registration clerk.
That's right. So with this, I'm going to close this portion of the program, and I thank you. Any questions at this point? And just realize we have 5 experts. They're also 2025 men's health champions who are going to come and answer everything for us. But any questions at this point that I can field? Yes?
Yes, well, to cut to the chase, I noticed that this gentleman here, part of our extended family, evidence-based, is in the sun. Now, depending on how much melanin we have, whatever, should he have his sunscreen? That's a good
That's a great question. Absolutely. Yes. Yes. The answer is yes. And we also need some sun, so for that vitamin D to help our bones and all that. But you are absolutely right. We have to protect ourselves. Great question.
So thank you, Dr. White. Introduce the panel so we can
Absolutely.
move it along quickly. You want to go to the
And so this is the part of the program that's really some fun for us because we get a chance to to ask some questions of our panel of experts. They also happen to be our 2025 Men's Health Champions. So we're going to ask them to come up on stage. We're first going to ask you to come up, Mr. Redden. Nice and round of applause. Mr. Dixon, please, won't you come up and join us? Dr. Keene, please, come and join us. Mr. Sanchez. Please come up and join us. So this is wonderful. We're going to try to figure out what's going on and what we can do to remedy some of these issues. I want to thank you for taking this journey with me as we explore the theme of today's summit, transforming the health and well-being of men and boys from silent struggles to stronger futures. We've reflected on the deep-rooted challenges, physical, mental, and emotional, that so many of our men and boys carry silently. But we've also lifted up the power of healing, the strength found in community, and the possibilities ahead when we create spaces where men can show up fully, speak honestly, and be seen. With that foundation, I'm honored to shift to our panel discussion. And we've introduced our panel and our champions. So let's just jump right into it, okay? We can roll our sleeves up. We don't have to be so formal. This is a great group. Let's talk about the current landscape of men's health disparities. So our first question that I'm going to ask is, what are some of the most pressing health disparities impacting men and boys in our communities today? Mr. Redden, would you like to start things off?
Sure. Well, when I think about the most pressing disparities, I want to start off with just mortality rates. Earlier gave a great statistic for black men's or men's mortality rates in Roxbury going up from 59 years of age to 60. And it reminded me of a staggering statistic that I learned at the Wellbeing Compact a couple of years ago. 2 miles down the road, with that day, the life expectancy just 2 miles down the road is 92 years. It's a 23-year difference for 2 miles. All right, if there was ever a line in the sand drawn, that's it. So it illuminated so much for me, like, wow, there's a ton that needs to be done to change that. Because there's definitely a way 2 miles down the road. So there should be the same way here. How do we get to that? We can replicate. Of course, it's going to, take some funding. It's going to take some dedication. It's going to take some time. But we know that it's possible because it's happening in other places. So, with that one disparity, they're fueled by others, right? Chronic disease, lack of access, as we mentioned earlier, just sometimes deferred care, cost of it. I think there are a number of things that we need to tackle to stem the ultimate disparity, which is the mortality rates. I guess I'll leave it there.
I can try. That was very good. Thank you. what I would add on to that is that it is different for men, having just completed my physical. What I learned is, hey doc, what are the things at my age now that I need to start to worry about? And without a hesitation, first is still heart attack. Despite all the news, the press, heart attack is still number one for guys. Stroke is number two. And those are factors that we do have in large part of the ability to control. Some of this lifestyle, food choices, things like that. But heart attack, number one, stroke, that's heart attack. And then from there you get into cancer. There's specific types of cancer, very unique to men. Prostate, colon, and lung cancer. The first two, the only way you can really stay on top of those is through an annual checkup. So partnering with some kind of a center similar to Whittier Health, regular doctor's appointments in those two areas. And then smoking, I think we all know about smoking. The statistic I have is, it's come way down obviously, but the CDC, I understand it's about 12 to 13% overall, but in inner city, the percentage is much higher. I think just understanding what drives, some of what the drivers of mental health are, and what we can do about it, there's a couple of those that are controllable, would be what I would add.
You can move to Sure, yeah, sure. I remember probably about 15 years ago, I was involved in a summer program in Newton with kids from China. And I remember vividly a park bench. They were all classmates and all friends. And they all had iPhones. And so about 15 years ago, before the iPhone really kicked in, every one of them was on their phone. And I realized they're not talking to each other. They're on their phone. What could be going on in their lives that they're not talking to each other? And it was the power of the phone. And what I would add to this discussion is the disintegration of community, right? It's framed. No one's going to church, or they're not going to church like they used to. No one's doing a bowling league, and we're isolated. And I think of when just this about Whittier Health Center, comprehensive, compassionate community, and I felt that the first time I came here. You just said it's a communal aspect. And it's not just that we bring them into the community. We have to accept people unconditionally. And when that happens, when people feel, especially in my work, dealing with people who are addicts, they believe it. If you really know what I've gone through, and really knew who I was, you run out of the room. And you convince them that, no. In fact, there's nothing you could say that would even raise an eyebrow. And when they feel that, they can really, really feel it. And I really think community is, that sense of community is so important. It's how we form.
Thank you very much. That's really very insightful. It's amazing how the cell phone has changed how we communicate and interact with each other. Remember when we were kids, keep going back, we were outside all the time, playing ball. We were playing with the kids next door, maybe wrestling, but we were still, that's the way we communicated, and that's how we came together. But that's a great point, Dr. Keene. It's on the social media, it's texting here or there, so we lose that opportunity to interact face to face. That's insightful. Mr. Sanchez, did you want to take a look at what are some of the most pressing health disparities impacting men and boys in our communities today?
As I'm sitting here trying to really think this through, right, I think Gentleman Matt can touch on everything, but if there was anything I could add to that, I think that access, right? I think access is one of the biggest things. I mean, we're talking about food deserts, you mentioned, culturally, lack of cultural, competent providers, thinking about limited health education. These are just some of the things that I can think about, off the top of my head. Hoping I can just add that much to what you guys have just said. But those are the things that jump out immediately, is that access.
Great point. Mr. Rothman, I'm going to go to another question. I think we have covered this point, unless you have something insightful to offer.
He has an answer.
Whatever your question is, Dr. Evans. Let's hear your answer. Now you're
Just quickly, I think it's access, of course. It's also, I also think it's the way we communicate about health in different communities. There's this very monolithic way that health is communicated. You know, don't smoke, don't do drugs, go get your checkup. It doesn't really work well for any community, but if you think about communities that aren't thinking is maybe a different perspective or a different lens or haven't had access to healthcare in the past, those kind of messages I think fall on deaf ears, because if you don't kind of reach someone where they are and speak to someone in a way that will make sense to them, I don't think you're getting them even if you do have access. So I think we need to really work to transform the monolithic way that healthcare is communicated, across the board, and especially as we see men and boys not seeking healthcare for mental health and for preventative health. I think we need to find a way to communicate in a way that makes sense and that they can be self-motivated to seek care.
That's a great point. One thing I've noticed with some of our providers is if a provider has been through a health issue, a mental health issue, physical health issue, and they're able to share that with their patient, that seems to give some kind of credibility, authenticity. Dr. Dean, can you just comment on that, sir?
Yeah, I find that so true. So my daughter's in med school, and she went through a very difficult time. And I explained to her afterwards, that gave you currency to deal, you'll be a better doctor. And especially in recovery, it's like you deal with people who, they know if you know. And that also gives strength to your own healing. What I was saying before, like, there's something redemptive about using your suffering to help others. I think that's exactly what you're talking about. Like this thing that you, like, I can't believe I went through that hard, Yeah, I know, but that was tuition. That helps you get the degree or the credit, the license, so you can now help people with that same issue and speak in a way that they will understand.
Yes, absolutely. Think, if you will, here's this provider who's got every single degree from every single Ivy League school ever, who has never experienced life or made any mistakes, and never really lived along the way, versus another provider, another person, another coach who has lived that life, has taken him or herself out of that situation with the help of the village, and can now speak on it. Who do you think the patient is going to believe?
Exactly. I read an article about depression. I know what you're going through. Nobody knows. No. Have you experienced it?
Yes, sir. Yes.
Listening to all the opinions, all the opinions that you guys, have given. We lacking, in perspective to say prevention and treatment. The community that, the communities in general, we find those disparities because the lacking of opportunities to prevent situations, and sometimes it could be inheritance also, like a sickle cell anemia on minorities. It cannot be detected early time because there is no prevention or tests or medical support for families, or if a child with those kind of disease, body aches, losing control of their mind, or just take a little pill, over the counter, and that but is not being detected what really the situation of the problem that has.
That's a great point. Anyone on the panel like to address that? We're talking about just treating the person versus helping to prevent those things from happening. Mr. Dixon, would you like to?
Well, if it's a serious genetic condition, I guess I'm not sure, other than your appointments, that's going to require a specific type of care. But what I would say from a very early age, all of us can do is make it a priority. Only you know, all of us are an expert on our own body, I think. So if you know something's off, I would say seek care, make it a priority, and advocate for yourself. I think those are the three things that I know I look to do for myself. I've had health, underlying condition, I think they're limited to the care that you're able to find.
Absolutely.
Before we go to the next questions, we have a special guest, City Councilor Flynn came and wanted to say a few words and congratulate the men's health champion. Councilor Flynn, thank you so much for joining us on a rainy Saturday. This is usually full house, but everyone decided to stay home. But we're glad you're here.
Thank you, sir. Thank you. I'm honored to be with everybody, and thank you to the distinguished panel that is here and was enjoying the conversation and was here last year listening to a similar conversation. As a district city councilor, I represent the south end, and I know a lot of my constituents come here. But what I want to leave you with one message. I'm active with the Veterans Administration and with the VA, with disabled veterans. But I was listening to one of the gentlemen say that you have to be your own advocate. You have to speak for yourself, which is true. But at the VA, historically, black men haven't been treated with respect and dignity. They haven't been given the services and the care that a disabled veteran like me here so I highlight that because there's just a lot of racism, there's a lot of turmoil in access for African Americans to get care, whether it's at the VA or the other facility. But I came here to support black men in advocating for equal access, for respect. Really, you're asking for respect. You're asking for dignity. You're asking for critical care that is necessary. But I do want to say thank you to Whittier Health for being a critical leader in that study, in that field, and ensuring that everybody is treated with respect. That's all I want to say, that I'm honored to be here with you today. And I have a resolution, but
Do you want to read the resolution?
Sure, okay. The 2025 Men's Health Summit taking place today. Whittier Street Health is a vital force in advancing health quality and care to undeserved communities across Boston. We thank them for serving over 30,000 patients annually throughout the city with comprehensive programs that address so many medical needs in our communities. Thank you for what you are doing. Okay, thank you. Thank you.
Thank you, sir.
Thank you.
Thank you so much.
Thank you, sir.
Really appreciate that.
Honored to be here. Thank you.
That was said beautifully. Treating people with respect, not just black men, but treating all of us with respect. So thank you so much. It's a privilege to have you here. Yes, sir?
Thank you very much. I really ought to thank you, Frederica, and thanking the device for this wonderful opportunity. I have enjoyed it so many times, coming to conferences, having medical attention, and reaching. However, there was something that happened from the beginning when I started coming to now. There's been a slight change, and this reflects on access. Everything the panelists have said is true, but access, there's an aspect of it that I think we need to highlight, and that is, maybe I have a neck pain, maybe I have a headache, and I want to go to hospital, and say, oh, well, you have to make an appointment for 2 weeks to see the doctor. If it's worrying you, go to emergency. Between the appointment to see the doctor in a week I'm going to emergency hospital, emergency ward in Boston Medical, where it's always spent 6 hours before the stay. It discourages one, and say, well, maybe the headache will go tomorrow, and then, so we find that a lot of people do not complain about their medical condition until it's too late. And so we need access. I'm thinking, is it possible to have a place where when you have a simple, what appears to be a simple symptom, you can quickly go outside the medical background, talk to you, advise you, and if they need to send it to a higher level, do so immediately. But don't wait until you have an appointment in 2 weeks' time or go to an emergency. Easier access. Is it possible? Thank you.
Thank you so much, sir. Thank you so much for addressing that. Would anyone on the panel like to address the access to health care issue that we have, not only here, but in other facilities? Wow. I'll just open that up. Mr. Rockman, any thoughts on that, sir?
I think when you think about getting access, there's so many places now you can go for minor symptoms, right? And there's these the urgent care centers that are everywhere that weren't really around 10, 15 years ago. I'm dating myself now, I guess, but you know. But then the problem is you go to these urgent care centers and you don't have the continuity of care. Right? And so you can walk in and they say, hey, we think you're okay, but if you're not better in a week, go see someone. Right? And I think before this model came up and people had dedicated PCPs and you had someone to kind of help you manage your care, because once you have someone you trust, it's much easier. But now I feel like everyone is out on their own. You walk into an urgent care center, you try to get treated, maybe it works, maybe it doesn't, but you're not really sure where to go, you have no anchor. And so I think you can applaud the availability of some of these urgent care centers, but what you lose is the ability to get the care that you need if something is actually wrong with you. And so I think we need to think about how to link up, how to empower people to really manage their own care, because if we're going to these disparate centers, if you come here to Whittier Street, you have arms wrapped around you and you have people to kind of help guide you along the journey, but so many people don't have that. There's a lack of primary care physicians, a lack of internal medicine, so if we can educate folks how to help advocate for themselves, manage their care, I think that would be a good point. Anyone else on the panel? Mr. Redden, would you like to
Yes, that was a very good point you made. I think that in addition to that, there's the thought around the access. Someone mentioned earlier about, I think it was you, mentioned having people being on their phones, right? And right now, there's so much access, if you will, through your phone, right, that it can almost be a deterrent for some people where, like say, at different facilities, they're able to, order testing right over your phone, right? You can get testing for yourself, and then go get tested, and Google it, and say, okay, this is what's happening, and that can be a deterrent sometimes from even going to the access that you truly should have. There's a lot of self-diagnosis that goes on these days. Sometimes we have a lot of information or result records where patients get their results portals. Here are results before our primary care. So we're coming straight in like, well, what's this mean? Why is this elevated? And we don't get the whole story around it. So I think that the information highway right now it's great, but it needs to be managed as well. It needs to be managed well so that people still understand that the access that they get should be with their primary care. But that's just a thought.
That's a great point. I'll make one quick comment, then I'll open it up to the rest of the panel. I think having access, I mean, we can go to our smartphones and we can look up any diagnosis, look up any ache or pain. We can go there, and it'll give you a whole list of possibilities. I think what I've noticed is that at least starts the conversation. See what I'm saying? So even though you may be home, you look up on your smartphone, what is back pain? What could it be? It could be kidney cancer, it could be all this crazy stuff. But it gets that person at home to say, maybe I should look into this. Maybe we should try to get that appointment, walk in to try to get this discussed. And so that's my perspective as a clinician. But I'm going to throw it out to the panel again about that access and getting information. Mr. Dixon, any thoughts, sir?
Well, I will be very open to disagree with you on one point. I think the internet's great, phones are great, a lot of good information out there, but when it comes to your health care, I think you want to get that from a doctor as best you can. But to the gentleman's question here, access, I mean, it doesn't always have to be a doctor. Physician's assistant is a fairly new career path that's out there. I always call it med light. I'm not sure if that's fair to any physicians and PAs in the room. But also a nurse practitioner. You can start small. That usually allows you to get a quick appointment. If you need to be seen today, you can start there and then find out if it is something, if it's above their head, they can quickly escalate it to a doctor. And I found that personally to be a good way of getting on the radar of a doctor if you really need to.
Great point. Dr. Keene, any thoughts on that access?
Thanks so much. I was going to say that if medical information is hard for you and you don't want to deal with bad medical news, just don't go to the doctor. And I think there are a lot of men who do that. And my father was one of them. His son, me, is one of them. And I visited, I was in the hospital visiting members of our organization this week. I'm not sure if it's access is the problem. We need help navigating this insurance system, this medical system. Insurance says, well, they denied it. Okay, and I'm one of these people like, okay, well, that's it. It was denied. I need an advocate. I need someone who will say, don't take that one. Or the doctor said no. It's also because you're articulating, you're not explaining what's going on. You need to go with more specificity, for instance. So it may be a real men's issue. And I'm actually, this is a great topic. Thank you.
Thanks very much. Thank you very much. Great points. We're going to bring us back into our current conversation about the silent struggles. And these are struggles, absolutely. So I'm asking the panel, how do we normalize conversations around mental health, especially starting with boys and young men? Mr. Redden, would you?
With regards to starting the conversation on mental health, I think it's a conversation that should be started early with our young men and our boys, actually. You mentioned earlier about, and I suffer from the same thing with my grandchildren. Like my daughter's hurt, my granddaughter's hurt, I'm running out. I say, hey, what's wrong with you, man? You know what I mean? If Mason's hurt, if Damien's hurt, little Damien's hurt, I'm like, you're tough, right? You good. So I think in those moments, I think that when we talk about mental health or just health in general, I don't think it should be a conversation that happens when something's going on. You know, it should be a conversation that's just talked about when we're talking about anything else. It should be something that, especially with our boys and men, is received well. We need to be thoughtful about it because I think, to your point, your earlier point as well, we have this expectation to be, as you said, stoic, strong, and when someone like our mom or our wife or our daughter talks to because of the perception, we might feel, for lack of a better term, like emasculated by it. Calm down, you know what I mean? But these are conversations we definitely need to have, so we should just have them when we're talking about parenting, just make it part of the normal conversation. And with kids, you start early. You know, how you feeling today? What's on your mind? Talk to the kids like they're not like children, but like people. You know, what's going on? You'd be surprised at the answers you get, especially these days for my kids. You know, they're online. They have a lot more going on out there, so they can talk to these days about things. So I think just starting those conversations early and making them part of the normal conversation, not just when in times of trauma or when there's issues.
Very good. Thank you very much. Why don't we continue with this important question? How do we normalize conversations around mental health, especially starting with boys and young men? Someone comes into my office and says, I'm feeling depressed. A strong, strapping guy, football player, and all that. How should I address that as a provider? So that's some food for thought. Any ideas with that? How do we normalize these conversations? Dr. Peach?
I'll just jump in. I taught middle school, high school also. Great you normalize this, right? You make it normal. And in junior high, I would say to kids, if you're acting out in class, don't stop. Halt. And HALT is an acronym. And it's for hungry, angry, lonely, or tired. And what you're helping them realize is that they're asking themselves, why am I acting this way? Am I hungry? Am I angry? Am I lonely? Or am I tired? Usually it's one of those. And when you address that one, it normalizes it. And the other is, I think it's really important for the adults to acknowledge their own mental health struggles. I'm not used to this, but when I got involved in whole lives, people would say, so how's your mental health today? And no one ever asked me that, but in this context, it was very normal. And I actually think there's great benefit for that.
Excellent. That's a HALT. I'm
HALT.
going to use that.
Excellent.
Mr. Sanchez, did you want to add to that? How do we normalize these conversations?
Yeah, I think it's making it part of our everyday conversations. If no one has already said that, I'm sorry to jump out and back in. If no one has said that, making it part of our normal conversations, right? So we're talking about normalizing this. I'm in a pretty unique situation where sports and education come together. So having these conversations in the locker room with our young men, in the classrooms, in our barbershops, like just making this part of our everyday conversations, I think will make things a little bit easier for our kids to sort of, be open to conversating or engaging with us because this is part of it. That becomes part of it.
That's a great point. Mr. Hoffman, any thoughts on this? How we normalize these conversations?
I think what we really have to do is make sure too that we're expressing some of this. Our kids and our grandkids can see us saying, we talk about our mental health, the mental health of people who are not children, right? So we can ask kids all they want, but they don't know what that looks like, right? And so if we have adults acknowledging if they're feeling upset or overwhelmed or anxious, I know for myself, I would never say that to my kids. I would die before I would say that, because you don't want them to think that there's no problem, everything's fine, we'll take care of it, whatever it is fine. But how will they learn if we don't show them by doing, right? So I think we all have to figure that out. I don't think it's necessarily just a men issue either, but I think especially men, we're so likely to say, if our kids say something wrong, because they know, right? Who knows it's better than our kids and our family? Something wrong, no, everything's fine. Don't worry about it. And I think we have to figure out a way to talk about it with them, that we can be vulnerable, and they can learn that it's okay to have those conversations. I don't have the answer to that, by the way, but I think we need to figure it out.
Yes, Mr. great point there, and it made me think of something. With regards to communicating with your kids or with your grandkids, a lot of times the kids will ask you something, you know, and sometimes we'll say, you know, why are you asking? You're too young to be talking to me like that. I think we need to start entertaining that, because when we kind of put the stop on it, that makes our kids less likely to share when we want to know something. So I think it's important that when kids reach out with questions, and they have tons of questions, but it's important that we begin to entertain those questions and let them know that there's an equal avenue for them to communicate. And to do that, they're more likely to share how they're feeling.
Yes,
I have a question. I don't know. I have 3 children, but I'm originally teenage boys. And so some of the conversations that you're having today, I'm wondering about what role women play in men's mental health.
great question. What role do women play in men's mental health? You want to just... Yes, ma'am.
She'd like to.
First of all, I want to say thank you so much to Ms. Williams and for this study. What's going on here is marvelous. It's wonderful. I didn't have enough information on it. But getting to the question, as someone who has gone through mental situation, really dire, I can comment on how it affected my husband, how it affected my sons, and now my husband is going through like a bad situation, and it brings depression on him. So I know how to support him, to encourage him about how he encouraged me to get out of the darkness that I was in. A woman is very important in a husband's life or whoever that you're, associated with, who might be going through mental challenges. So they are important. And also, I want to make a challenge to those who are here. It's a wonderful opportunity, and I was just wondering, is there an outreach for going out like scouting to look on the streets sometimes, because there are people who are mentally disturbed, who are in paraphernalia, who are just sort of bound up. I talk to them, but because I don't have any place to take them myself, but I do try to minister to them. But I was wondering if there are any vehicle that goes out like Common Square, look on the street, and like they scout for basketball and football, scout out some of those things that are going on. That's a challenge. All of us who are here can identify somebody and report it. Thank you.
Thank you. Thank you so much. I'm glad you said that. The question is, what are women's roles in men's mental health? You got a great point, the outreach portion. Because it's so hard to get, as I mentioned, it's so hard for men to come in. Okay? From my perspective, I think the women, the daughters, granddaughters, sisters, they are so responsible and help out so much to get that man into help. So I wanted to comment on that, and also outreach. We do have a team. In fact, our men's health team goes out into the community to help take care of our patients. They may not even be our patients at that point, but community members to get the help that they need, whether it's vaccines or physical exam or behavioral health needs, substance use needs as well. So that's a great question, and thank you for contributing. That's Mr. Redden's mother who contributed that. Yes, sir.
Yeah, a comment that molded my life, I'd like to share it real quick. After my take, well, first of all, peace and blessings, assalamu alaikum, shalom aleichem. A horrible event, my take, that's known as 911. And I remember I was going across the airwaves in the Boston area. There was an FCC licensed broadcast station, 96.9 FM Talk, so-called the best and the brightest. People were chiming in about what had happened, or venting about what had happened, what might be happening. Very quickly, the conversation turned to making slurs about folks in that part of the world. One time I wanted to chime into that conversation. I remember my name is Bob. Bob is up next. And I said, the FCC permits for better and worse any comment to be broadcast over the public airwaves except the equivalent of yelling fire in the crowded theater if there is no fire, or profanities over the broadcast airwaves. Regrettably to me, there is a lot of money to be made broadcasting mean-spirited talk radio. You called your listeners the best and the brightest. There was someone before your time who had a lot more listeners than you. He called his listeners the master race. Then I hung up, that's all I wanted to say. Well, this talk show host, who's now passed, he responded to every single thing I said. He said, Bob's a coward. Bob hung up. Bob wouldn't interact with me. Bob reminds me of someone I knew in the 2nd grade. Bob is an expert on his own opinion. And now I, J7, as he was known, J7, I'm colorblind. Bob chose to inject, race, into this conversation. Maybe that makes Bob a racist. And am I mean? And I'll be back with you, the best and the brightest after this. So after the commercial, pretty much the response was, Jay, don't mind him. They went on with what they're doing. So my quick comment is, now, in terms of where we're at since 911, and in terms of who has the authority, and more specifically, who is now on the CDC and some of the latest vaccine recommendations and other things, could we be at risk in terms of what's available and in terms of our my extended beloved family? And I just thought I'd put it out there, and thank you for that time to share.
Thank you very much. Thank you very much. Absolutely. There's a lot of things going out over the airways. We all have to be careful. We all have to listen with an intelligent ear and not buy into everything that we hear on the airways. And that's my comment.
It's not just on talk shows, right? I just feel like so much of the key for men in mental health is vulnerability and accept Mr. Sanchez as weakness. You know, if I ask for help, it might be an indication that I'm weak. But if we turn the news on, you know, there are a lot of angry people doing harmful things to the most vulnerable among us. And I can only imagine it causes people who are weak to say, I don't know, I'm strong, I'm okay, I'm not one of the vulnerable. And just pass that on. I think it's very important.
Yes, Mr. Fuller. I just wanted to just touch on two women that we were talking about earlier, and to the women in particular, right? So, just a quick story. You know, a few years back, you know, you guys know I was diagnosed with cancer, right? My wife was riding all the time. Gotta get into the clinic. Gotta get into the clinic. Now, this is prior to knowing that something wrong, right? And I'm saying this just to encourage you, as women, to continue when your husband is telling you, yeah, I got it. Yeah, I'll do it tomorrow. Yeah, I'll do it the next day. Don't get tired. Keep fighting the fight. Because if it wasn't for my wife, the doctor told me that I did get in there. I don't know how long it was after the fact. I know that it got to a point where she was like, listen, you're going. If I got to drag you, you're going. And I ended up going in. And the doctor told me that if this were a month later, we wouldn't be having this conversation. Right? So I implore you, even when your husbands or your significant others are pushing you away to say, nah, I got it, I'll do it tomorrow, or I'll do it the next day, to continue encouraging him to get to the clinic and get seen. don't stop.
We're coming to the end of this program, this part of the program. I would like to ask our panelists each, in 30 seconds or less, please, what's the one thing that you want everyone in this room to take away with them today? Can we start with Mr. Dixon? So what's the one thing?
One thing we want everyone to take away, we'll go back to a couple things. I'm sure I say it right. Again, from my perspective, you're your own best advocate, you're an expert on yourself, so by all means, there's some excellent centers like Whittier Street Health and other ones here in Boston. There's some of the best health care in the world. Take advantage of what we have here in Massachusetts. So we want to take
Dr. Keene, can I ask you the same question?
Very simply, community is important. Community is vital.
Mr. Rotman, your one takeaway message that you'd like us to know?
I think we just need to remember that not everyone is the same. We can't communicate the same way to everyone. We need to find ways to reach everyone where they are and get them what they need, regardless of whether we agree or not, whether we understand it or not, or whether we've done it before. And so reach out, connect with people, and help them get whatever they need, even if it's not what you need.
Excellent. Well, here, Mr. Redden, your one
Absolutely.
takeaway?
My one takeaway would be that everyone who is here, you've already taken a great step. And we all have the power to impact someone else, at least one other person, with what we've learned and heard here today. And we can all do that. It should pay itself forward.
Mr. Sanchez, we'll let you close this portion. So one takeaway.
This one takeaway is that I just want to say that healing is not a luxury, right? It's a right. And all of us are very deserving. Men and young men of color are very deserving. And I just want to say that that's just that healing is not a luxury, but a right. So we have to continue to push and make sure that all of our kids and young men and people of color are getting what they deserve.
Excellent. Thank you. How about a nice warm round of applause? They're all the champions. You can see why. So, thank you very much.
Thank you so much.
Remember that we are better together, all better together.
Absolutely. Thank you very much. Thank you very much. Sure. Ms. Williams?
Well, thank you for that wonderful panel discussion. Lunch is on the way. They're running late. They were supposed to be here at 12:15. But I have a few raffle items. Did you, thank you to our champions on our panel. I'm just eager to get into my raffle items. This was wonderful. You guys, you did a wonderful job. This has been wonderful. Thank you to all of you. This is usually a packed house, but I'd rather have 5 people who are engaged, and this has just been wonderful learning from all of you, your insights, Dr. King and Word Hall, so that we can use those words, and we learn so much. And thank you for your insightful questions. Thank you, Dr. Wright. Thank you to my colleagues who work day in, day out, deeply committed. There are 300 of us that are at this site, aside from Blue Hill, we have several school clinics. We have a large fleet of mobile vans, about 5 of them, and we go to different schools, including the Dr. Sanchez's school or the Epiphany school. We meet people wherever they are, and it takes, and lunch is right on time, as I was saying. And so this for me is a life mission, and just a wonderful, wonderful blessing, and a gift to me and to my family to be of service to this community. So thank you so much. A round of applause